Hundreds of healthcare workers are taking to the streets. The practitioners are marching to the health department demanding placement. They want to be placed in public facilities to complete their 12 months of community service. And eNCA's Heidi Giokos is following that story and joins us now for an update. So Heidi, just tell us about what this picket is all about. What are these healthcare workers demanding, and from where do they come? Where do they come from in terms of the streams that they come from into the medical professions?
Sure, Tilas, I must say that the picket was quite short. The memorandum has already been handed over to officials here at the Department of Health, but it's oral hygienists together with dentists that have decided to picket outside the Department of Health, demanding that they be placed in community service and internships as they have not been placed, which makes it very difficult for them to complete their community service of 12 months. But we are joined by some students here to get more clarity on this. Barry, thanks so much for your time. Let's start with you. What are your demands? What are you asking the Department of Health to consider?
Thank you very much for your time. Our mandate is very much simple. We want ComServe from the department because everyone in South Africa, according to the Constitution of South Africa, Section 27, everyone has the right to health service. So we want community service. We want community service to the Department of Health, and we're not going back about it. We're not retreating, and we're not going to surrender. And according to the legislation of South Africa, oral hygienists and dental therapists, they qualify as independent practitioners, meaning they can open their own practices. And before they open their own practices, they must serve for 12 months, of which the government is not giving us that 12 months to serve under government. We must serve that 12 months on private practices, of which is not possible, my sister. It's not possible at all, because you can go and serve, you can go and do that 12 months under supervision on a private practice. But what if the practice owner passed on in 3 months? Where are you going to go? On top of that, HPCSA needs us close to 5,000 rand, and this thing is stressful. We can't even focus on our exams because of this issue. So we want ComServe from the government, and we're not retreating to that. Our mandate is very much clear.
Okay, Katlego, let's speak to you quickly. You have given the department 10 days to respond.
Yes.
Of course, this is an issue that doesn't only affect oral hygienists and dentists. We know that there are certain doctors and nurses and other healthcare practitioners that have not been placed. What do you do if the Department of Health does not respond within 10 days?
Okay, thanks for the opportunity. This thing is very simple. We are going to subject this type of arrangement to the intensification process. But of course, we can't talk about the nature of the intensification process here, but of course we are going to follow due processes and make sure that everything it's being done accordingly. As you can see that we are being affected, we don't know where to go as soon as we are done here, and this thing is not only affecting us, even the BSc students and other students are being affected. And our call is that let's get ComServe, but it doesn't only end there, because our government is failing us, my sister. We mustn't shy away from that. So we are going to extend it to say that after ComServe, how are we being absorbed? We also want to be permanent as well, but we are starting at an early stage to say that let's get ComServe and do the right thing.
Sure, and then Fortune, I'll just end off with you. Many would say that it's quite unfortunate that healthcare practitioners have not been considered, placed, especially during a pandemic when there's such need for healthcare, even if it's oral hygienists, even if it's dentists. Speak to us about how difficult it's been, the fact that you guys have not been placed.
Thank you very much for the question. My sister, it's like a trauma, this thing. If you can check how this thing has been developing, if you can check our then Minister Arong Mutsualedi, he was introducing NHI, and NHI specifically deals with primary health care. And if you can check, oral hygienists and dental therapists are the ones who are supposed to be dealing with the primary health care. But as it stands now, we are being neglected by the system of which is supposed to be assisting each other. So as it stands now, my sister is like, we are in jeopardy, like we don't know what to do anymore. We are frustrated, and our frustration now are showing signs now. Then, as for going forward, we don't know what we're going to do going forward. But as you have alluded, my leader here, that we won't expose all our cards. We'll always play our cards close to our chest, and then wait for the department to reply, and then we'll take it from there.
Okay, great. Thank you so much. We wish you all the best, and hopefully the Department of Health responds within 10 days to us, because I do believe that this is quite a concerning picture. Many would say say that COVID-19 has made the situation worse, but this issue has been going on for some time now. I mean, if you just heard what one of the students, Fortune, just said, it dates back to then Health Minister Aaron Motsoaledi. So hopefully the issue is dealt with as quickly as possible, because I must tell you that the morale is very low here amongst these students, as they feel there's no point because they are just not placed years after they're supposed to have completed their 12-month community service.
Yeah, we can only hope, Heidi. We can only hope that it gets resolved, because it's not like there's no need for these services in communities in terms of supporting our public health initiatives. It's just a matter of people finding one another and doing the right thing. That's eNCA's Heidi Giokos there reporting on that picket by those medical students who want to be placed.